It's going live. You're good.
All right. Sorry for the delay, everybody, and welcome to our fourth installment of our weekly report outs. This is January 5th, 1 o'clock, Kansas City Metro. And we had some technical difficulties there with YouTube, but we're now up and going. We'll get into the dashboard and everything, but we have a special guest this week. Dr. Wild's has a time crunch, and so we wanted to start with him. But I will just say, if you would like to sign up for the emails on this, please go to covid.ks.gov/report-outs. That's with an S on the end, and you can sign up to get an email of this conversation and the attached dashboard. But Kenny, will you introduce Dr. Wild to us?
Happy to do that, John. So I'm Kenny Welk, Vice President of Government Community Affairs at the University of Kansas Health System, and we're delighted to have Dr. David Wild join us this afternoon. Dr. Wild is in our Chief Medical Office there at the University of Kansas Health System and really is deeply engaged in all matters with COVID on the data and the care side. So I'll let him give a bit more of an introduction, and he's going to give us an overview of what's happening in the Kansas City metropolitan area, especially in light of just coming out of the holiday. So Dr. Wild, the show is yours.
Well, thank you, Kenny, John, everyone. As mentioned, my name's David Wild. I am an anesthesiologist by background and training, still do make it to the OR a day or so a week on a good week, specialize in anesthesia for transplant if anyone is particularly interested. On top of that, as Kenny mentioned, I have a role in our physician leadership structure, as well as being vice president for performance improvement for the health system across the state, which means I do a lot with measuring and sharing performance, and have worked extensively, as Kenny mentioned, with the other chief medical officers in the Kansas City metropolitan region over the past 10 months to understand what is happening in our hospitals as it relates to both the clinical care of COVID patients and how we can share information, but also hospital capacity and this conversation about what impact on a daily or weekly basis are COVID patients who wouldn't normally be in our hospitals this time of year, right, in any other year. What impact are those patients having on our ability to keep our healthcare delivery system functioning? And so I was asked to give a little bit of insight into what that means in the Kansas City metropolitan area. As you all know, there are a number of sources of information that we can look at to give us an idea of that picture, whether it be a KHA dashboard, whether it be the sort of national look using HHS Protect data, or even inside the metropolitan area sources of data like EM Resource, which is more an actual, or I should say actionable set of data and information around staffed available beds this shift, for example. And so on that front, one of the questions I think that everyone always asks is what's happening with ICU capacity, because that has undoubtedly been our largest crunch. In the metro area today, I can tell you we are around the 15% available capacity or less mark. And a week ago, we were a little bit better off, maybe 20 or 25% of the ICU capacity is available. That does mean, as I just sort of painted a picture, that our impact, the number of beds available, at least in the ICU front, is decreasing over the course of this week. In fact, we are very, very much similar to where we were going into the Thanksgiving holiday now. Not quite at the peak, but really close. And that is true in number of new cases and number of new deaths as well as we balance out the reporting. So, for example, our own hospital, so our University of Kansas Hospital in Kansas City, Kansas, on the 1st had 111 total COVID positive patients. 62 of those were acute or active and on isolation. 51 were recovering, meaning they had been in the hospital more than 10 days from their initial onset of infection and didn't require isolation anymore. And about 24 of those active or acute patients were in the ICU and 11 on ventilators. And in just 4 days, right? So today now on the 5th, we are over 135 patients as of noon today. So an increase of just over 20, with now 74 acute, 27 in the ICU and 13 on the ventilator. So while those increases in ICU and ventilator patients are only slightly higher, single digits, than they were a few days ago, the overall impact, no doubt, has increased. And we expect that to be the pattern over the next few days. One of the other things that I do on a regular basis is help manage transfers into our organization as a quaternary referral center from areas not just across Kansas City, but also from across the region. And lately that region includes all of Kansas, half of Missouri, actually maybe more than half of Missouri. And lately more and more calls from places like Iowa, Nebraska, Texas, Oklahoma, Arkansas. And while those calls had decreased over the past maybe 3 weeks or so, they have picked up in earnest again this week as we hear more about new cases and new hospitalizations in southwestern Kansas, especially related to meatpacking plants, and across areas that we know have been hard hit, like Oklahoma, Wichita, and even into Texas. So that's a little bit of numbers about what it looks like for us. I can tell you that we talk daily, including again this afternoon, with every chief medical officer, or every chief medical officer is invited from every hospital across the metropolitan area. And in talking with a couple today about what they're seeing as we prepare to touch base this afternoon, there are hospitals on the Kansas side of the metro who have told us today they have 0 available ICU beds. And that is dramatically different than it was even last week. So I think the trend and the story that I'm telling you with our data, at least, is being is bearing out in a similar fashion in a handful of other places on the Kansas side of the metro. Just in looking at MARC data from today, the Missouri side is worse off, maybe 10% or less of available ICU beds, staffed ICU beds that are available for use. So that's kind of the picture. It's not dire. It's definitely not good. It's worse than it was a week ago. And it does seem like we're going to come out of the holidays, for whatever reason, hitting the ground running. So Kenny or John, I'm not sure if there's anything else you'd like me to hit on that's a broad strokes kind of picture.
Well, I'd ask a question, and I apologize, I should have got this. Have you looked into your crystal ball, and do you have any feel for what we might expect through the month of January?
Yeah. So as we get a much larger data set, and this is sort of taking a population health view now and not a healthcare delivery system view, but as we look at a much larger data set, and it's really everything that's available nationally, we start to see some pictures that, and this is not a surprise, but solid evidence that two things are really standing out as it pertains to driving hospitalizations and outcomes. And when I say outcomes here, I'm really talking about the primary binary outcome of, do you survive a hospitalization for COVID or do you not? The percent of your population that is over 85 is one factor that is weighing heavily in understanding which states have more hospitalizations and more deaths. The second factor is the percentage of your population that is obese. And in both those cases, Kansas, for example, is far above the national average. So more of our population is over 85. I think it's around 1.9%, with the average being about 1.1 or 1.2%. And we are 11th in the country. So not 11th in a good way, but 11th as far as percent of our population that is obese. So those things together, along with what appears to be continuing community spread of COVID, really does point out that there is a very real possibility that January looks no better than, say, November or December, and very possibly worse as it pertains to hospitalizations and deaths across the state.
Have you seen any correlation between hospital capacity and death rate? As hospitals fill up, that outcomes go down?
So big picture, absolutely. Although not in Kansas yet. And I hope never to. But when I say big picture, what I mean is that early on, the mortality rates for New York and New Jersey, for example, showed very, very clearly that when hospitals become overwhelmed, the death rate goes way, way up. And we do not want that to happen. There are a number of levers that we have to pull there, but they are really mostly before patients hit the hospital. So we have plenty of evidence that if you get overwhelmed, truly overwhelmed, and start putting 2 patients in every ICU room and changing your staffing ratios, for example, instead of an ICU nurse having 2 patients, making them take care of 4, that the mortality rate goes up and goes up quickly. We've not reached the point where we've had to institute any of those crisis standards of care, meaning changing staffing ratios or where we house patients, for example. And so we've not found that here in the metropolitan area or really anywhere in Kansas. But that's, of course, one of our big concerns. And we know that El Paso was an example recently where those things may have happened. St. Louis has had some examples. I have contacts. I trained in St. Louis, and so I have contacts in that market that and very clearly know that they've had to put 2 ICU patients in 1 ICU room. That those things are not far-fetched, and that we all have a responsibility and a role to play in keeping us from getting there.
Thank you, Dr. Wild. I know you're pressed for time. Just one clarifying question. When you said 15% or less ICU capacity, was that just KU Health Systems?
No, I'd say that's the metropolitan area number now. And again, the Missouri number that I saw today using the MARC data, which is really based on a combination of HHS and local operational shift-based data, showed a 10% or so available capacity of staffed ICU beds on the Missouri side, and a little bit higher on the Kansas, maybe 17, and it was averaging out to be about 15%. So that feels about right too for us and for others. And so I would say that while that's an aggregate look, it's very real. It's not like we have lots of staffed available ICU beds around in the metropolitan area.
Thank you so much, Dr. Wild. We'll let you go. I know you got Kenny. Do you have anything you wanted to add there with him still on?
No, but thank you, Dr. Wild. Really appreciate you joining.
You're welcome. Thank you both. Take care, everyone.
Thank you very much. So I'll just flip real quick to our dashboard here for Kansas City. Won't spend a whole lot of time on it, but as you can see, this was from Monday. 22% of adult staffed ICU beds available. That's obviously swung now to 15% or less. We say this every week, but those are very dynamic numbers, and ignore that 0 underneath that. But 22% here in, well, this says Southeast Kansas. I got the wrong one up. Sorry about that. There we go. Okay. So 19% pulled up. Sorry, I had the wrong one, guys. And that's now fallen to 15%. So this is a dynamic, fluid environment. Obviously, sounds like not going in the direction we'd want it to. You can see here with cases, there was that Christmas dip that we talked about. So still kind of in that statistical plateau area here as far as the metro goes. Let me jump off this. I will say too, on the staffing shortages, you'll see that number 9% there across the state. The difference being when the new year came on, federally, hospitals don't have to report staffing shortages. So a lot of hospitals in Kansas left that blank this time. So that number's artificially low, knowing that there's still staff issues out there. We're hoping we'll have the hospitals participate coming next week. Now let me go ahead and just kick it over to you, Bryant, or Kenny, if you want to add on the hospital side while we're on it, and then I'll kick it over to Steve.
I'll just defer to Brian.
Well, Kenny, thank you. John, I was going to say that there's really not a lot to add, given the depth and the knowledge that Dr. Wild shared with everyone today. I do think, you hit a couple of things there from a data tracking standpoint, where the default changed to a no on critical staffing shortages in hopes of that creating a little bit better information. And then as Dr. Wild mentioned, a lot of the information that is also at a more operational day-to-day level is being collected through MARC and some tools that they have access to. And, there's just a lot of coordination going on throughout the community. Probably the biggest thing is, the emergency departments are continuing to stay busy, so outside of COVID, in addition to COVID. And that just, always continues to present throughput challenges for hospitals, and then for the EMS agencies, it all kind of trickles downhill a little bit. So just wanted to make folks aware that, the emergency departments are maintaining the, high volumes, and that creates additional burden on the system right now. But, as with the rest of this, known issues, known challenges, and everybody's pulling together and doing the best they can to work through it all.
Thank you, Bryant. And I'll just add this real quick. I know we're starting to get short on time, so I won't belabor this, but I know through the EM resources, which is what EMS uses to know where to take patients, that there were 11 hospitals last night asking for patients to be sent to different emergency rooms. So, that care it's real as far as it kicked 5 of those trauma centers into a force open situation. And so, something we're watching, but that's a little alarming as we know the reality what the hospitals are facing. Let me kick it over to Steve Mayhew real quick. Steve, from a public health standpoint, can you tell everybody what you're doing today and just give us a quick breakdown on what's going on in your world?
Yeah, absolutely. Steve Mayhew with the Johnson County Department of Health and Environment. John and Dr. Wild and everyone kind of touched on what the numbers look like in terms of case rates, and John touched on the dip that we saw around Christmas week, but we also saw that same dip in Thanksgiving, and really is likely just a result of fewer tests being run, not fewer cases being out there. So just wanted to reiterate that point. If I sound like I'm in a gymnasium, I'm actually on site at a mass vaccination clinic today, and that's kind of what public health's focus is. I won't say shifting to, because we're still really focused on testing as well, but we've added that vaccination component to our plates as much as we can. We are vaccinating throughout the metro area healthcare workers with all the vaccine that we have. And I say it that way because, after the initial shipment that our health departments have received, we haven't received additional vaccine from the state. And from what we're hearing, it's because the state doesn't have vaccine to give. And so we've got a lot of healthcare workers. We know that the numbers that we're able to vaccinate are not, everyone in that first tier. And so, if you're not hearing from your county officials or your health departments, or you're not hearing from anyone about the vaccine, it's likely that you are in the system, and we're just waiting to get that vaccine so we can turn around and get it to you. And so I really want to emphasize that point. I know today in Johnson County, we're doing a clinic where we hope to get 12 to 1,400 people through, today in one of our sites. We plan to do another clinic tomorrow. There's a survey that we put out, and I think this is true for Wyandotte as well. Both of those 2 counties were fortunate to partner with their federally qualified health centers and get some additional vaccine in addition to that initial state allotment. And so we're trying to make the best use of that we can. We know it's not enough, like I said, to get to that first group, but your health departments are working really hard to try to get that out there. We don't want it sitting on our shelves or in our freezers. And so when we get vaccine, we turn around and give it. And on that note, we also don't exactly know when vaccine's coming in. And so we hope to expect a shipment for public health maybe next week. It's a supply chain issue, but the first shipment we got, it showed up before the notification. And so if it feels like it's a quick turnaround time, it is, but we're trying to remain flexible to get this out there, because there's a lot of people who want it and need it. And like I said, we don't want it sitting in our freezers. And so vaccines are the big focus for us. It's exciting, it's a lot of work. And I know that, as the vaccine becomes more available, the landscape of where vaccine is available starts to shift. And we could talk more about that, I think, on future calls.
Wonderful. Thank you. Yeah, as the data comes in and the vaccine rollouts, I know I was on the phone with KDHE this morning, and it really does sound like it's a reporting error through the software as far as the vaccines that have been deployed inside the state. Kansas actually is one of the few states that got vaccine out to all counties in the state, and it's a processing through the hub and spoke deal. And so I even know some of the larger centers are having issues with the software that reports into that, but I know that's being worked on. So Steve, thanks for what you're doing. Thanks for the quick report out. Just real quick, the stat in the KC metro area from last week's testing through KDHE was 11.94% positivity rate and 3,500 new cases. Let me kick it to Dr. Watson just real quick. Got about 3-4 minutes left if you can give any kind of report out as it looks on the transfer side, and you're muted right now. Can you unmute yourself?
Yeah, I just want to show one screen just to reiterate how tight it is. When we're looking for beds across the state, this is what we're seeing in the top tier 1 referral centers across the state. So the KC metro area, you're getting sicker patients, obviously, they're staying longer. Fortunately, there is more capacity in some of the more regional referral centers, but we're seeing that sick patients are taking longer to get placed, and we're seeing wait times up to 3, 4, and 5 hours to find a bed in some cases. So As you can imagine, this makes everything else back up. Fortunately, at a regional level in some of the more critical access hospitals, they do have a little more capacity, but right now the bottleneck is the sick patients trying to get into the tertiary and quaternary referral centers.
And I think as you and I were talking earlier, if you are non-acute, you're able to find bed and care. But if you're really in that acute, moving up to the more sophisticated hospitals, that's where you're seeing the wait times go up and not down. Would that be
Yeah,
correct?
amazingly, the wait time looks almost the same, but it's because the wait time on the low end is shorter, but the wait time with the more acute, severe patients is actually longer. So certainly in pockets of the state, we're seeing very protracted times. So.
Well, thank you, Dr. Watson. Before I wrap it up, Kenny or Brian or Steve, anything you'd like to add?
Nope.
Nothing here.
Okay. Well, I appreciate everybody's time. And just will say, let me put this information out there again. I think as we come into January and as we have some of these leading indicators, I think it'd be important to follow these report outs for the KC Metro and the rest of Kansas. If you'd like to get the automatic email, please go to covid.ks.gov/report-outs. You can also email us at ksregionalreport@gmail.com. ksregionalreport@gmail.com. We'd love to hear from you and make sure, but we'll be, as we have vaccine data, we'll be sure to share that. And we'll be watching what's going on with our hospitals very close to the edge right now. And we'll be waiting to see if we get this holiday surge, but it's beginning to look like that might be happening. I wrote down the quote, "We're hitting the ground running coming out of the holiday," was what Dr. Wild said. And that sounds about right with what we're seeing. So thank you guys for your time, and we'll see you the same time next week. KC Metro Call every Tuesday at 1:00. Thank you guys for committing your time to this, and we'll see you next week.